Sinai is a crucial part of New York, so we should represent that at all levels. Not only the patients that we see, but the students that we train and the faculty that we recruit. We should be diverse as New York is, just as much as New York.
It's important to have a diverse student body, a diverse residency program, a diverse faculty body, because that's the mission of the institution.
If we're going to provide the kind of care that we think people deserve, we have to understand where they're coming from culturally, spiritually, and the diversity that's added by bringing faculty and students in from different backgrounds is what allows us to deliver that kind of care.
The CMCA has been a critical and a very important force in allowing us to have great success in being a diverse medical school. They played a major role in recruiting top medical students from all different backgrounds and recruiting faculty who also represent many different backgrounds. And that makes us a great place, great medical school, great hospital.
It was difficult for me to navigate the application process as a non-traditional student. And I found mentors here at CMCA that provided several programs in the Center for Excellence, as well as mentors with Dr. Aponte and Dr. Butts that helped guided me through the application process.
CMCA has been instrumental in my success. It's very important for me to have a place to go to where I know I can be honest and I can get really great guidance while here as a student.
Coming from a background where you might be the only one that's ever gone to college, you're the only one that actually speaks English, it's comforting to be in a place where you can find other students that might be on the same track as you and to find support.
It is so easy to go and speak to faculty there. I remember when I had some trouble in second year with the academic curriculum. I felt a little bit overwhelmed, and I just felt that I needed to speak to a faculty member, and they offered that.
It's definitely a challenge to increase diversity in our student pool. And a big aspect of that is that there are very few minority students that are in the pipeline.
The pipeline programs started with the medical school back in 1968, starting out with high schools, then working up to college programs, and then back down to middle school programs.
My journey to medical school started when I was in high school. I had an opportunity to attend educational lectures, to give presentations myself, and shadow physicians one-on-one, and learn not only learn about the bench to bedside aspect of medicine. And then I came to Mount Sinai as a student.
It's not just about numbers. It's not just about bringing folks in and who come from different backgrounds. It's about treating a community. It's about understanding the community and having cultural sensitivity and cultural competence and understanding that how culture plays a part of healthcare.
I was very interested in the research program in the immunology field, but at the same time I also had a very sort of strong and long-standing background in community service. And so when I came to Mount Sinai, I found out that Sinai also had many programs such as EHOP, which would allow me to do this while allowing me also at the same time to still do cutting-edge research.
Bringing medical students into the community and having them be aware of health issues for people who live in a certain neighborhood, or health practices of people who live in a certain neighborhood or come from a certain culture is really important, and I think that that's something that this office does.
I think CMCA has a connection to the community, knows these populations that need help, and then reaches out to us and gives us that opportunity.
This is the community I'm working in, this is the community I'm serving. When I see these patients in the clinic, I know I can almost relate to them because I've been living in a part of this community rather just basically being an outsider looking in.
The sense that a lot of students get from Mount Sinai, even just interviewing here and visiting the surrounding areas, is that it's really not an ivory tower. It's very community-based. The service that we provide to just neighboring areas is tremendous. The challenge for us as a hospital and as a medical school are going to be to stay true to our values no matter what. No matter how hard it gets, if we have to make very difficult strategic decisions, at the top of the list, at the top of the triage list, has to be our commitment to the community and our values surrounding the concept of diversity and why it's important.